Good evening. It's Dr. Chris Laurie from Disc Centers of America in Roanoke. We are here again with one of our Facebook live streams. Um, what we'd like to do tonight is spend a couple of minutes talking about peripheral neuropathy, what it is, uh, what are the possible causes of it, and what are the treatment options. We treat peripheral neuropathy in our office, and we've just added some new programs to try to help assist in that. So we've had a lot of questions on this program. We give everybody just a couple more seconds here. We've got some people signing on. We've got a lot of new followers. Welcome to this page. Welcome to this Facebook Live. Again, if you have any questions, you can post those. You can send a private message or you can email me. I've actually put our website on the description of this talk tonight. So you can go to that website and there's a way to email us through the website if you have any questions regarding neuropathy, regarding anything as far as treatment goes. Let me shift that a little bit. Yeah, that's better. Okay, so again, a lot of questions about peripheral neuropathy. What peripheral neuropathy is? Some kind of symptoms, pain, numbness, tingling, uh, weakness in the peripheral parts of the body. It typically affects the legs and the feet. That's the first area, but some people do get neuropathy in their hands also. Okay, so this is can be sharp pain, constant numbness, tingling, a prickly sensation, pins and needles in your extremities. The causes of it are multiple. Number one, it could be coming from your spine. People with degenerative, bulging, ruptured, herniated discs in their back that are pinching and irritating their nerves at the spinal level can lead to peripheral neuropathy or symptoms in the legs, feet, bottom of the feet, toes. And then if you have and that's with the lower back. And if you have some kind of neck problem, that can lead to peripheral neuropathy in the arms and hands. So it could be a spinal related problem. Obviously, we've already heard one of the side effects or long term effects, I should say, of diabetes is peripheral neuropathy. Uncontrolled diabetes can lead to effects in the peripheral nerves, which leads to peripheral neuropathy. Again, typically that starts in the feet and the legs, but there are patients that have let their diabetes go for so long that blood flow, nerve flow in those areas will affect the hands too. It can get so bad that you can lose the ability to use your extremities with diabetic neuropathy. The other thing that can cause peripheral neuropathy is cholesterol lowering medication or statin drugs. That's one of the side effects, one of the common side effects of people with a long term use of statin drugs. Some other causes are side effects to toxic chemicals. If you've had some kind of chemical toxicity or been exposed to some very toxic chemicals, that could lead to peripheral neuropathy also. And then chemotherapy, people, cancer patients who've gotten chemotherapy and radiation, they can have symptoms of peripheral neuropathy also. So the key, just like with anything in our office, we have multiple treatment protocols. And with any kind of treatment, you got to find out the cause of the problem and then develop a treatment plan non-surgically with some of the methods that we have to help the neuropathy. So if it's a spinal related problem, we want to first determine if the nerves in the back are being affected by a ruptured herniated disc affecting the nerves going down your legs. If that's one of the causes or one of the things causing the peripheral neuropathy in your back or hands, we'll treat that with spinal decompression therapy will be one part of your program. We'll do the decompression therapy in the lumbar spine. We'll do decompression therapy in the neck. Then we also want to try to increase blood flow to the extremities, increase blood flow to the feet and hands. And we have a number of different methods that do that. Number one is vasopneumatic therapy, which is a series of cups that drive energy through the lower extremity or the hands, which is going to increase blood flow to the area, help to cut down on inflammation, irritation, swelling, pain. Laser therapy can be a very effective also. Either cold laser or class 4 laser stimulates a body response in the body to increase blood flow to the area, which also helps neuropathies. One of the things we want to do in the peripheral nerves is increase blood flow to the area to help the nerve function better, help the body handle the symptoms better. So, class 4 laser treatment or cold laser is very effective in that also. Um, we also have a number of other techniques: red light therapy, vibration therapy. We do foot baths with electric stimulation. A lot of these are done at home with our new program, and we'll put you on a program that you'll assist any kind of in-office work with treatment at home. When you're trying to increase the blood flow and get the neuropathy functioning better, it's something that needs to be worked on every day. This isn't a one-time treatment. It's a constant work to try to improve blood flow function and decrease nerve irritation in those areas. So it is a long-term treatment at home. The treatment in the office usually isn't long, but we have a very high success ratio. There's tons of studies showing that we can improve the neuropathies. Now, if you're a diabetic and you're not controlling your A1C and your diabetes is out of control, again, that's going to be something that we can't work with. And that's one thing that needs to be handled in order for our treatment protocols to have the success that they have. If you've had surgery on your spine where there's any kind of metal rods, screws, plates, fusions, and things like that in the spine, we cannot handle that part if that's one of the causes of the nerve interference dealing with your neuropathy. That's something we can't work with either. We cannot tell you to get off the cholesterol medications, but now there's some new ones out that don't have the side effects. So that's something you'd have to talk to your medical doctor about to see if that's something can be helped. But many cases, we can help give relief of the symptoms, stop the symptoms from getting worse. It's a case by case basis. So the key would be for you to set up a consultation. Let me determine which one of these things are the causes or the combination causes of the neuropathy you're dealing with. And if we can help you develop a program to begin to combat all those things to help the nerve flow, help the blood flow in your extremities to function better. For people who are candidates, like I said, they get tremendous relief of these type of symptoms. So if you're interested in doing that, you can simply, let me get this thing going here. You can simply call our office. It's going across the bottom there at 540-600-4630. Or like I said, our website address, where I talk a lot more about this, is in the description of tonight's Facebook Live. You can go to that and email us at info@roanokedisccenter.com. I'm happy to do a phone consultation or discuss this via email or whatever. But there are a lot of new options with the new treatment protocols for people dealing with neuropathy. So I appreciate it. Tonight was great. I hope you have a great evening. And again, keep sending different things that you like for me to discuss during these Facebook Live sessions, so you can get educated on some of the things that are out there now in order to help you. Okay. Thank you. Have a great night.